had one inmate, I won't forget him either. He would make me draw blood on the web of his fingers. That was the only vein left. And he said that's the only vein I left for the medical staff to give me my medications. Whenever I came in, he'd be like, you need blood? Right here. And you got one shot and I know you can do it. First 2 times I was like shaking. No, you can't do it shaking. That's how he said, you can't do it shaking. By the time I left that facility, like I was the vein whisperer, okay? Like I could draw blood on anybody in the dark within 2 seconds. Hi, my name is Missy, and I worked on a corrections unit at a large state hospital for about 3 years. After becoming certified to be a medical assistant, I applied to many different places, and this was the first place that called me back. And it was just a very rewarding experience. Contrary to popular belief, like the corrections unit was probably the safest unit in the entire facility. The patients, though they are inmates, they respected medical staff differently because medical staff treat them or made them feel like they were human and not just an inmate or a number. So the relationship between inmate, patient, and medical staff was different from the relationship between corrections and an inmate. You learn very quickly how to just make sure that you're paying attention to your intuition, picking up on cues of danger. For example, there are some patients who want extra cookies, and if you tell them, no, you can't have this extra cookie, but you give bed B a cookie, you won't give bed A a cookie, the next time you come in, the CO or another person in that bed will probably flag you and say, don't come in here, just to kind of let you know that somebody's kind of looking out for you, or don't turn your back on this person, or they'll just let you know, hey, you can't go back in this room. I've had experiences where patients are admitted because they ingested disposable stethoscopes, or they like ingested scissors, or they ate different type of like medical devices so they can get out of the prison and go into the hospital. A lot of them are being abused in their cells with their cellmates, so they'll do anything to get out. And you would think they want to relieve the pain, but they're fighting against their bowels to keep the abject in so that they don't have to go back to prison. Caring for those patients is like medical practice against human will, right? So the doctors are ordering different type of medications to help expel the object, and the patient refuses to let the object out. A lot of repeat patients, and they find new ways to do things. Like, for example, we had this patient came in, same person, ate a stethoscope. It was, again, disposable, so very bendable. He held on to that stethoscope for about a good 2 weeks. He would not have a bowel movement, just so that he would not go back. He wouldn't eat. He was definitely focused on the prize. He lasted 2 weeks, but you know, he came back around this time and he put a pen. He took out the casings and like the pen ink and everything, and he stuck it into his genital area. When he came in, we had to definitely treat him and, like, you know, surgically remove those items, and the damage that was done to the sphincter, to the urethra, to the penis shaft was gruesome, but you know, that allowed him to stay there for a few months. Coming into this practice as a medical assistant at this hospital, I had no experience with drawing blood, but it was the inmates who gave me confidence, right? Like, the inmates gave me confidence. They would tell me, you can do it. Go ahead, this vein right here. I had one inmate, I won't forget him either. He would make me draw blood on the web of his fingers. That was the only vein left. And he said that's the only vein I left for the medical staff to give me my medications and things like that. Obviously, we couldn't do IVs there, but whenever I came in, he'd be like, you need blood? Right here. And you got one shot and I know you can do it. And I kid you not, I took me a 23 gauge butterfly needle, the light blue one, and I would get it every time. The first 2 times I was like shaking. No, you can't do it shaking. That's how he said, you can't do it shaking. So eventually I calmed my nerves. With his help, okay? You got this. Come on, take a deep breath. Now, you know, make the bevel 15 inches. He was better than me. By the time I left that facility, like, I was the vein whisperer, okay? Like, I could draw blood on anybody in the dark within 2 seconds. Again, I know this is gonna sound crazy, but put me in corrections any day. It's the safest and the people are the nicest and they respect you. I just learned a lot. Like, I saw different people, different walks of life, people who came from extreme wealth and people who, maybe didn't have too much growing up. I've seen it all. And so it just taught me about how to be a person with integrity and lack judgment, which I appreciate. There was a patient, he had end-stage cancer and he was in jail for buying a hot guitar. He didn't know it was a stolen guitar. They tell you not to play favoritism with the patients, but I would make him grilled cheese sandwiches. It was not the traditional way. It would go toast some grilled cheese bread, put some butter on it, throw some cheese on it, let it melt, cut it in half. That's how he liked it. I would never forget him because I just felt like he was innocent. He didn't know he was buying a hot guitar, but you just never know. So I think the biggest thing for me was just the art of caring for the human outside of what they may have done. We just don't know. The one thing that they tell you when you work on these type of units is don't look at what this person did. Do not look up their rap sheet because it will definitely affect your ability to care for them. If I can just tell the world, hold your judgment. Nobody's perfect. And if someone is coming from a corrections facility versus coming from a castle, I think you should treat them the same.